All right, peace be to you. Omar Abdul Malik, physician assistant and health educator. So today I'm going to talk briefly about confidence in your clinical thought process, and especially this for lead clinicians that are physician assistants like myself, nurse practitioners, and of course physicians. So I had a situation at the hospital where there was a decision that had to be made about a patient, and I was hesitating because there were some potential dire consequences with this particular situation. And one of the nurses kind of jumped in and started like telling, no, this is what you got to do. This is what you got to do. And I was kind of angry at this patient, which is, I tried to control my anger, but I realized that my hesitation was kind of delaying what needed to be done or what did not need to be done with this patient. Let me stop here for a second. So I realized that there's different perspectives for people, different clinicians, depending on their level of responsibility and their level of accountability. So for a PA, our level of accountability is very high. We're kind of second in command, if as it were. Think of it as being on a battleship or something. You got the captain and the co-captain or the person under there. So, when I'm there in the hospital by myself, I got to be the one to make the decisions. Not everybody may agree with that decision, but ultimately, I will be the one whose head will roll should something go awry, and my supervising physician will also be harshly admonished and possibly penalized. So, I have to try as much as possible to do what I think is clinically correct and ethically sound. So this particular nurse didn't want to hear that, but I realized it made me realize that I have to really keep abreast of my clinical knowledge, because a lot of times we hesitate because we're unsure of ourselves. And that unsurety comes from a lack of knowledge, which can be from a lack of experience or a lack of just general book knowledge. So I say that to you guys that are new clinicians. Maybe you've been practicing for less than 5 years. I've been practicing for 20 years as a PA now. There's a tendency to get very complacent in your knowledge, because unless you're studying for a recertification exam, which now for PAs is every 10 years, just like the doctors. In between that time, well, maybe you're reading some journals or going to some conferences, but you're not reading every day. And that can affect your knowledge base, because you will forget stuff. Not everything is routine. Most of it's routine, but you've got those instances where things happen that are out of the ordinary, and you gotta really act upon your knowledge base and your ethical decision making. So, I say it to you guys to say, try to discipline yourselves to read something every day. It's something that one of my mentors told me, Dr. O from Howard University, said, read something every day, even if it's just a page. The world is mourning the loss of Kobe Bryant, and of course his daughter. One of the things I heard about Kobe Bryant was his work ethic. He trained in the off season. He didn't wait for the basketball season to actually start where he started training. He was lifting weights on the court, drilling in the off season. So he had months where the other guys might have been relaxing, He was training. He never stopped. And that's what made him exceptional. So try to be an exceptional clinician no matter what your capacity is. All right. So I wish you guys the best of success in your positive endeavors. If you're interested in a career in allied health, or living a positive lifestyle, you want to become a PA like myself or a health educator, I just need some advice about school and education, please feel free to subscribe to my channel. Take care. Peace.